Ovarian cancer occurs when abnormal cells start uncontrollably replicating in the ovaries and or fallopian tubes. Before digging any deeper, let's go over some of the basics of what the female reproductive system looks like. Deep within the female pelvis is the uterus, a pear-shaped muscular organ that houses a developing fetus or baby. Besides the uterus are two small oval-shaped glands that produce eggs and hormones such as estrogen and progesterone, which help regulate the menstrual cycle. Connecting the uterus to the ovaries are narrow tubes called fallopian tubes. These tubes act as a passageway for the egg to travel from ovaries to the uterus. It is also the location where the egg is normally fertilized by the sperm. Now back to ovarian cancer. There are three main areas where ovarian cancer can originate from. Let's start with epithelial ovarian cancer, which accounts for 90% of all ovarian cancers. This type of cancer develops in the outer protective layer of the ovaries and or fallopian tubes, called the epithelium. The second type is ovarian germ cell tumors. These can be malignant, meaning cancerous, or benign, meaning harmless. These tumors are clumps of abnormal cells that originate in germ cells, which are cells that develop into unfertilized eggs within the ovaries. This type of tumor most commonly affects just one ovary and usually impacts teenage girls or young women. The malignant tumors account for less than 5% of all ovarian cancers, and roughly 20 to 25% of all germ cell tumors are benign. The third type is stromal cell ovarian cancer, which originates in the stromal cells of the ovary. Stromal cells make up the supportive network of tissue called the stroma that hold the ovary together. It is also here where hormones like estrogen and progesterone are produced. Stromal cell ovarian cancer is roughly 1% of all ovarian cancer and are most prevalent in women over the age of 50. But about 5% of ovarian stromal tumors are found in young girls. So how does this cancer even develop? Well, the normal progression of ovarian cancer is usually as follows. Stage 1 is when the cancer starts in one or both of the ovaries and stays there. Stage 2 is when the cancer spreads to other parts of the female reproductive system, such as the fallopian tubes or the uterus. Stage 3 is when the cancer starts to travel to organs in the abdomen, such as the stomach, intestines, liver, etc. Stage 4 is when the cancer spreads beyond the abdomen into other organ systems, for example, the respiratory system, where it could affect the lungs.
Why exactly should we care about ovarian cancer? What is its importance? Well, did you know that ovarian cancer is the fifth most common cancer for women, but has the lowest survival rate of cancers affecting women? In fact, 1 in 78 women will develop ovarian cancer in their lifetime, and 1 in 108 will die from it. While those numbers may seem small, using 2021's female population of 3.9 billion, that roughly translates to 50 million women developing the cancer and 36 million dying from it. However, the most shocking and disturbing part is that only 16% of all ovarian cancer patients are diagnosed early, giving them a 5-year survival rate of 49.1%. The vast majority don't get diagnosed until the cancer enters the 3rd or 4th stage. But why is that? Why is ovarian cancer diagnosed so late, especially when this leads to poorer outcomes?
Well, one aspect that makes ovarian cancer particularly difficult to detect and control is the lack of specific symptoms that make the cancer apparent in a timely manner, often only appearing when the progression of the disease has made it incredibly difficult to treat. One of the main symptoms to look out for is abdominal bloating, which encompasses an increased abdominal size as well as increased abdominal and pelvic pain. Another symptom is inexplicably feeling fatigued or tired all of the time. A few others to look out for include having difficulty in eating, either because of a decreased appetite or feeling full too quickly, as well as urinary changes, such as increased or more urgent urination. As one may guess, these symptoms are clearly very generic and nonspecific. They can commonly be caused by completely benign conditions, as well as perhaps cancers of other organs. Research has shown that many women who have ovarian cancer complained about symptoms well before they were diagnosed. However, because the symptoms are so nonspecific and usually caused by something less serious, arriving at the diagnosis can be very challenging. Often, most of these symptoms are just as likely to occur in women who do not have ovarian cancer. However, when caused by ovarian cancers, these symptoms tend to be persistent and a change from normal. If they occur more often and more severely than normal and occur consistently for a few weeks, it is important to notify your physician so the problem can be treated as necessary. But that's not all that's difficult about identifying ovarian cancer. Diagnostic testing for ovarian cancer is just as tricky. But why?
It is important to highlight the fact that it is quite difficult to get a clear diagnosis of ovarian cancer, as symptoms are often masked and many tests require further testing. This is partly because there are no reliable and specific screening tests that can detect cancer within the early stages of disease progression. The only real way to know if you have ovarian cancer or not is to get a biopsy, a procedure where a piece of your own ovarian tissue is taken for examination for cancerous cells. However, there are a number of diagnostic tests that can help a physician decide whether you need a biopsy to determine if you have ovarian cancer or not. One of these diagnostic tests is the transvaginal ultrasound, which uses sound waves to take a look at the uterus, fallopian tubes, and ovaries by inserting an ultrasound wand in the genital area. It is able to detect tumors in the ovaries, but it wouldn't be able to tell you whether the mass is malignant or cancerous, or benign or harmless. Therefore, more testing is often done. A second diagnostic test that could be done is the cancer antigen 125 blood test. This is done considering women with ovarian cancer have high levels of CA-125 in their blood. However, this is also the case in other common conditions such as endometriosis and pelvic inflammatory disease. This makes it hard to identify if ovarian cancer is the root cause for elevated blood levels of CA-125, and physicians need to further test to cancel out all other possibilities. The third diagnostic test is the pelvic exam alongside imaging techniques. During a pelvic exam, the physician examines the pelvic organs and checks for enlarged ovaries or signs of fluid in the abdomen, as these are signs of ovarian cancer. During imaging tests like CT scans, pictures are taken of the abdomen and pelvis to help determine whether the mass, cancerous or harmless, has spread to other tissues and organs. As you may have noticed, none of these tests alone provide a 100% diagnosis of ovarian cancer. This is why often a biopsy is done.
So, to recap, ovarian cancer is a silent killer because 1. The symptoms are delayed and only develop after the disease has reached an advanced stage and is largely incurable. 2. The symptoms are often not specific to ovarian cancer. It is easy to pass off the symptoms for benign or more common reasons, such as having menstrual cramping. And 3. There is a lack of reliable screening tools to detect ovarian cancer, despite pelvic exams, transvaginal ultrasounds, and CA-125 blood tests being used in the diagnostic process. Knowing this, what can you do to be aware of this condition? Other than monitoring your own symptoms to see if there is ever a change, be aware of the various risk factors associated with the increased chances of developing ovarian cancers. Sometimes ovarian cancer manifests in a family pattern, although it is unclear whether the pattern is due to shared lifestyle factors, genetic risks, or even chance. Women with a first-degree relative with the disease have a greater chance of developing ovarian cancer. A family history of breast, colorectal, uterine, or pancreatic cancer also increases the chance for ovarian cancer. Moreover, mutations in breast cancer gene 1 and breast cancer gene 2, which increase the risk for breast cancer, also increase the risk for ovarian cancer. Another risk factor includes never having been pregnant, as hormones present during pregnancy have been hypothesized to have a protective effect. Now that you know why exactly ovarian cancer can be so dangerous and what to be aware of and to monitor within yourself, share this video with your friends and family to help unmask the silent killer.
If you are a Canadian citizen looking to get more involved, consider fundraising for Ovarian Cancer Canada, the only national charity that advocates for the health and well-being of women living with and at risk of this disease through research, advocacy, and support. By raising your voice on social media, donating to further this important work, educating others on the disease, and hosting fundraisers in your community, you can help further progress against this disease to help save lives. For more information, visit ovariancanada.org.